it is important that the anatomy is studied so that the surgeon can know exactly what area of the body the heart is located. So you will not start looking for the heart in the abdominal region, whereas the heart is located in the thoracic region. Hello, good afternoon, and welcome to Anatomy Check. This is another episode on teaching you anatomy, dishing anatomy, and serving it like a master chef that we are. Okay, so first question: have you ever wondered how your body knows exactly how to breathe, when to take in oxygen, when to take out carbon dioxide? Have you ever wondered how you know exactly when to move your legs, what exactly happens when your hand moves, the structures involved in the movement of your head, when I rotate my head, when I turn, when I look at you, when I blink? This is all because there are very specialized structures in your body that comes together to make this very possible. You're welcome to today's episode, and we're going to be doing a brief introduction on what human anatomy is. All right. First question: what is human anatomy? All right. So human anatomy is the study of the structures of the human body, all of the component structures that come together to ensure that this complex body functions appropriately. All right, so we are contrasting this with what we know very well to be human physiology. Human physiology deals with the functions of these structures. Stay with me. All right, whereas human anatomy deals with the structures itself, physiology deals with the functions. So I'm saying, if anatomy deals with a structure and physiology deals with a function, so we're saying anatomy and physiology coming together is saying this structure functions to do this. Take your bones for an instance. So we say, what is the structure? What are the structures that makes it possible for you to be able to stand erect? All right, when we're looking at all of the structures that come together to make it possible for you to stand erect, so we're going to be looking at your bones, we're going to be looking at your cartilages, we're going to be looking at all of the ligaments that comes together to ensure that your joints are properly formed, the bones are properly fixated, and every other part of your body. All right, so now when we're not talking about what now makes for the motion to be possible, we're not looking at exactly what is the function of the bones, exactly what is the function of the cartilage, exactly what is the function of the ligaments, and what are the functions of every other thing. So I'm saying in essence that anatomy basically studies the structures, every structure in your body. That is what human anatomy is, while physiology looks into the functions. So human anatomy is the branch of science that studies the structures of the human body and its relationship with its various parts. All right, so that is what human anatomy is, while physiology is the branch of science that studies the function of these various structures. I hope you got that. We need to also understand why the study of human anatomy is important. All right, human anatomy is very important because it makes it possible for health professionals to understand the relation of the body with each other, the relation of the body with its various parts. All right, take for example your surgeon. If a surgeon wants to conduct a surgery, probably let's say a cardiovascular surgery, it is important that the anatomy is studied so that the surgeon can know exactly what area of the body the heart is located. So you will not start looking for the heart in the abdominal region, whereas the heart is located in the thoracic region. We're going to look into that, different regions of the body. All right, so stay with us. All right, third question: what are the regions of the human body? Okay, so when you come to studying anatomy, we study anatomy by regions. You can also decide to study anatomy according to organization of life. We'll go into that aspect. Okay, so studying anatomy by region, the first thing you need to check is, you need to look into is that the first region that we study is the head and neck. The head and neck comprises of various structures that makes it possible for your head and your neck to be intact. So while studying the head and neck, it's important that we note that there are several structures that makes for the head and neck. All right, structures like your brain. We are going to study the brain especially. Okay, remember this is an introductory class. I'm just trying to round off. I'm just trying to give you a summary of everything that the anatomy of the human body comprises of. All right, that's what I'm starting from. I'm telling you that there are different ways you can study human anatomy. You can study it regionally, so you can study by you can do it by studying your regions, that's head and neck, thoracic region, abdominal region, pelvis and perineum,
and all of those. You get then, of course, your appendicular regions, your limbs, and all of those things. All right. Now, you can also study human anatomy by the organization of life. And when I say organization of life, what I mean is you can study, of course, you can study it by cells. Okay. Remember that your cell is the basic unit of life. Basic means minutest. So the first approach to life is a cell. So your cells, when culminated, gives rise to what we call the tissues. Now, the tissues, aggregation of several tissues, come together to give rise to what we call our organs. So several organs now come together to give rise to systems. So when we now begin to study anatomy according to the organization of life, we're now studying cells, after which we study several tissues in the body. For example, your epithelial tissues, your muscle tissues, your connective tissues, your nervous tissues. Okay. Now, after studying according to tissues, we will now study the organs. So several tissues now came together to give rise to an organ. Examples of organs: your stomach, your liver, your kidney, your gallbladder, what have you. So all of those organs, when they now come together, several organs, we have specialized organs coming together to give rise to systems. So for instance, when you come to something like your digestive system, you have organs like your stomach, your esophagus, your large intestine, your small intestine, several organs that makes up your digestive system, including specialized or accessory organs like your liver, your pancreas, of course, that has cells that secrete your insulin and glucagon for the utilization of your glucose and glycogen. That's when we are talking about the digestive system. So when we talk about your reproductive system, we have something like your vagina, organs like your ovary, organs like the penis, several organs. So what I'm saying is, this is another way to study human anatomy. You can decide to study it according to the organization of life, or you decide to study it according to regions, where I first mentioned your head and neck, comprising of your skull, comprising of your brain, comprising of your eye, even, yes, your eye. They are all studied in the head and neck. The organs in the head and neck, your eye, even your nose, and the nasal cavities, all of those, your ear. Okay. Now we have regions like the thorax. When you come to the thoracic region, now your neck is in your neck. It's in your neck. You study some of the cervical bones, your vertebrae. We're going to all of this. Remember, this is introduction. So I'm just trying to explain to you how we study human anatomy. Okay, so now let's go fully into the regions of the human body. Like I have said in previous videos, all right, we have several regions of this body, of your body, of the human body. The first region is the head and neck. So we call the head region the cephalic region. Cephalic. So in anatomy, anywhere you see cephalic, just know it has to do with the head. Okay. Now, in the cephalic region, we have several other structures that makes for the cephalic region, or that comes together to give rise to the head region. Okay. We have the skull. Okay. Now, the skull is an aggregation of several types of bones. Okay. The skull is an aggregation of an accumulation of several types of bone, a coming together of several types of bone, meaning that it comprises of several bones. Example is the zygomatic bone, right? The frontal bone, the parietal bone, we have the maxilla, we have several bones, including the nasal bones, all right? Temporal bone, I don't know if I've mentioned that. So a lot of bones came together. Aggregation of those bones gave you the skull. This your skull, yes. And we study it when we study the region of the head, the cephalic region. We study the skeletal component, because every region you study the muscular component of that region. You study the skeletal component of that region. Okay. So for the head and neck, we have those skeletal components I have mentioned. All right. Now, in studying the head and neck, also you study several organs. For instance, you study the eye. So we study the eyeballs, study the orbit, okay, which is the area of the skull that plays host to your eyeball, all right? We study the ear. That's where you find out the inner ear, the middle ear, and the outer ear, which you call the pinna. So all of these are studied in the cephalic region. Okay, now the second region would also be looking at while we study human anatomy is your cervical region. It is in this cervical region that we study some of the arteries that runs through, of course, the arteries that runs from the neck through to the head, some of the major blood vessels that runs to the head through the neck, and then we study some of the muscle. For instance, your sternocleidomastoid muscle, sorry for that, sternocleidomastoid muscle, that's the muscle that is connected to your sternum, all right?
Remember that I said that every region we look at, in every region you come to, you're going to look at the bony components of that region. So when you pick up your anatomy textbook to study, if you are studying regionally, okay, you pick up a region, your labor is to ensure you find out the muscles in that region. So for the region of the neck, which is the cervical region, we're going to be studying the muscles. Examples of the muscles you can find in your neck is your sternocleidomastoid muscles, your trapezius muscles. Then you talk about the bony components, you have the cervical bones of the vertebra, okay, the C1 to C7. All right, then we come to another region. Of course, you look at the arteries too and the veins. Then another region I'm going to be looking at now is the thoracic region. Okay, now when you come to your thoracic region is a large region. Now the thoracic region is that region that is usually called the chest region. It is your chest area. Okay, now this thoracic region comprises of several major organs like your lungs and your heart. All right, now in this thoracic region also we have the rib cages. You can see them, the rib cages. Now the rib cages are the articulation of your ribs. So in the thoracic region we have your ribs. Okay, of course, when we'll be studying the region particularly, we'll look at the ribs. Okay, we have 12 ribs. We have classification of your ribs, your typical and atypical ribs, atypical ribs. Okay, and we have your floating ribs. All right, so in the thoracic region we also have, that is where we have the thoracic vertebrae, which is the T1 to T12. Now look at how the vertebrae run. The vertebrae is what we call the backbone. Okay, now the vertebrae runs from your neck. Immediately after your skull we have the neck. So remember we named the first vertebrae in the neck region C1. So it runs from C1 to C7 and picks up at T1, which is the thoracic region, which ends at T12. All right, and then it picks up at the lumbar region and then down to the sacral region. That's how your vertebrae runs down. So remember, we're still going according to region. Okay, according to region. You can leave your questions in the comment sections, or whatever you have to say, or whatever you have to ask, or whatever you do not understand in the comment section. So when we're doing our next videos, we'll be able to look into it and touch it and then bring a better explanation to you concerning that. Okay, so now by the time we are done with the thoracic region, remember I told you that you have to look at all of the muscles, all of the organs, and all of the bony components. So in the thoracic region we have talked about the ribs, which happen to be the bony and skeletal component of your thoracic region. Now we've looked at the muscles, some of the intercostal muscles, the muscles that run through your ribs. Okay, and then several other muscles around the rib cages. Okay, now we also have the organs like your lungs. Your lungs are protected by your rib cage. All right, then we also have your heart. Your heart is also located at the thoracic region. Now we come to another very important region, which is the abdominal region. Now this is the region where you actually know who studied anatomy, with which you know who studied anatomy or not, because sometimes when it comes to you and say, my stomach is paining me, and I go, your stomach, what area? And they're like, around this side. And I'm like, that's not where your stomach is. Because as an anatomist, as a student of anatomy, a very good student of anatomy, you need to know that saying my stomach is paining me is not the correct term, except you are accurately sure, very sure, that it is your stomach that is paining you. Why? Because your stomach is not located at your right hand side. It tilts more towards your left. Okay, so when you are having abdominal pain or pain around this region, simply say, I'm having a pain in my abdomen. That's better. All right, so when you are now asked, you will now be asked what region, because the abdomen is divided into 9 regions. Okay, so see how you're going to check for the regions of the abdomen. We're going to look at these regions one after another. Remember, this is an introductory class continuing from our last class. Okay, just a running through everything that has to do with human anatomy. Okay, now when you come to the abdominal region, we have, now wherever you are, follow me. Now look at your abdomen. You draw a line, all right, then draw another line. So when you draw a line above your umbilical region, you draw another line just beneath your umbilical region. Okay, now that umbilical region is the umbilical region. Now the region just above the umbilical region is your epigastric region. The region just beneath the umbilical region is your hypogastric region. Okay, now when you get to your epigastric region, the region by the right and by the left is your right and left hypochondriac region. Hypo, below the chondriac. Remember that anything that has to do with chondrite has to do with the rib, the costal cartilages. Okay, so it is just beneath your rib cage, and that's why it is called the hypochondriac region. Now when you get to the umbilical region, that region there is the umbilical region. Then left and right is the left and right lumbar region. Okay, then when you get to the region of the hypogastric region, all right, the right and the left is right and left, either you call it iliac or you call it inguinal region. Is that okay? So those are the 9 regions of your abdomen. Remember I said divide into 1 above the umbilical region, 1 below the umbilical region. Okay, so when you have 1 2 3, then you have 1 2 3. When you count the whole region, you're having 9 regions. So that's how we check for the region of the abdomen. And now in each of these regions, we have several organs found in each of these regions, and we're going to be looking at those organs. So in the right hypochondriac region, you have your liver there, you have your gallbladder there, and you have your right kidney located. Remember that the kidney is mostly accessed through the back because it is posterior. It is located at the posterior part of the abdomen. All right, so that is how you locate organs. So basically what these structures are for, what that division is for, is to make it possible for you to locate the organs in the abdomen, make it possible for you to easily access the organs in the abdomen. So when you come to me and tell me my stomach is paining me, and I'm like, what region of the abdomen is paining you? And you say it's around this right side, as if it's going towards the back. I know that that's not your stomach. Something is, do you understand? If you consistently now feel pain around the region where I suspect your kidney is located, I'm going to be saying it seems like there's something wrong. So you might have to do, after checking 1 or 2 other signs, we might now have to say, oh, do a kidney function test. But that is for your medical professionals. Okay, so you see why anatomy is very essential for medical professionals too. That is why anatomy is very essential for medical professionals, because it makes it possible for them to actually know the exact region that is being affected by any pathology or anything that they are looking at. Is that okay?